tooth decay is actually the #1 chronic disease in children. And unfortunately, it disproportionately affects children who come from lower income families, children with special healthcare needs. We actually have a big problem with unmet dental needs in Alachua County. When we look at it from the number of children who are going to the emergency department, in Alachua County, we have 2 times the rate of persons that are going to the emergency department for preventable dental conditions compared to the average of the state of Florida. So this is a really big problem, and going to the emergency department for a dental reason is not going to solve the problem.
We would see many children in public schools through our Sealand screening programs. We send letters home to parents to let them know that we've identified needs in their children. And from there, parents would have information for providers that they could potentially contact. We noticed as we returned to the school, so we would see the children, that they weren't able to connect with these providers. It's not that they didn't know that their children had dental issues, it was actually getting them to the dentist, whether that was transportation issues, being able to afford the dental care, taking time off work, also challenges with providers not being able to see children perhaps if they require special accommodations or have any level of dental anxiety. So what we decided to do based on this information is expand our program. The children that we identify in the schools of having these dental needs, rather than just sending the letter home to the parents, we now say we will also see your child in these mobile outreach clinics that we're able to provide around Alachua County.
So many of our families have difficulty getting in to get exams for their children for many reasons. Programs like Saving Smiles and this partnership allows us to put them in the community. And without it, our children are prone to problems. They won't be able to come to school, so therefore we have chronic absences. They don't feel well, therefore they can't learn. Oral hygiene and oral health is at the cornerstone of ensuring that our children receive all of the necessary benefits that they need to be their best selves.
Some of the programs that Saving Smiles provides community screenings, oral examinations as well, which provides families that would not normally have access to services to have access to those services specifically and directly in their communities.
In Saving Smiles, we will work with children of all ages. One of the interesting aspects of Saving Smiles, however, is that we will work with very young children. There are guidelines that children should be seen for dental care by age 1 or at the emergence of the first tooth. And so we will see children as young as 6 months of age.
The child is able to receive restorative or surgical care such as dental fillings, removal of a decayed tooth, so that way the root of the problem is addressed. This is an opportunity for us to not only provide preventive dental treatments like cleanings, fluoride varnish, dental sealants, but to also have some really impactful oral health education with the parent to allow them to feel empowered about their ability to engage in healthy behaviors for themselves and for their children.
The way that we're able to provide care to children around different locations in the county is we have mobile equipment that we have been able to purchase through generous donations from community partners in Alachua County, and we are able to also take x-rays on children, and we're able to do this on site, transporting the equipment through the use of this van right here.
I remember my first day going out because that day I was able to provide behavioral consultation. There were kids that had special needs. I was able to give the providers some help. I felt amazing. I remember the first day I left, I went home and cried because it felt like I had done so much, and it made me feel like I could reach out to other providers and help other people, do the same thing and collaborate with dental providers.
It was honestly a really good experience for me overall, and just being able to see how big of an impact on the community it has, and being able to see some of the patients back again throughout the years, and seeing how their oral health has improved has been a very rewarding experience. It really does show how community efforts does play a really big role in terms of improving their whole entire life.
The website where you can go to find more information is cdbs.dental.ufl.edu. Some things that you can do to help: we're always looking for collaborative partnerships in the community, maybe places where we can hold our Saving Smiles programs, places where we can promote our programs to children and families who may benefit. If you're willing to donate dental supplies, we would kindly welcome that. And of course, financial contributions are always welcome towards the purchase of supplies or supporting our amazing dental personnel. And of course, we're always looking for volunteers.
There is a huge need. The care that's provided is free because of the funding that we've been given. Unfortunately, there is a need and many disparities that exist, and with certain groups in society have particularly strong, particularly severe levels of problems in terms of oral health. And I think Saving Smiles helps to address that.